Thank you everyone for joining the webinar, Building Community-Centered Innovation Ecosystem, How COVID-19 Affecting Our Practice on the Ground. My name is Ikue, and I'm serving as an Innovation Coordinator for ADRRN Innovation Hub. And I'll be moderating the session with Takeshi today. And quick update, the quick housekeeping before we start. The next slide, please. Yes, so your mic is disabled just to avoid background noise, but you can always ask questions to speakers using the chat box. And when you do, please make sure to specify the name of the person you wish to ask a question. So we make sure that your question is addressed to the right person. And the question will be held until the speakers finish the presentation and also the panel discussion. So appreciate your patience. Okay, now, next slide, please. So this webinar is part of 2020 Regional Humanitarian Partnership events. And we'll discuss with our country partners how they've been building partnership relations in the complex innovation ecosystem and how COVID-19 pandemic changed their way of working. And through the sharing and discussion, we'll try to demonstrate the importance of adapting to changing dynamics of innovation ecosystem, particularly when placing community at the center. And today we have three distinguished speakers from CDP Philippines, CIS India, and YAU Indonesia. And all of them are building community-centered innovation ecosystem in their respective country with slightly different approach. And you'll hear their journey shortly. And now I would like to invite Takeshi, who is the Secretary General for ADRRN and then also the representative of ADRRN Innovation Hub to make an opening speech.
Okay, well, thank you, Ikue, and thank you everyone for joining today and for the speakers from our respective colleague agencies. Warm welcome from ADRRN. You know, recently, I think it's been a constant reminder from last year and this year that disaster risks are really compounding and cascading, and we're living in an era that we call new normal. It also means that tens of thousands of people are affected by various types of disasters on a daily basis, and COVID-19 has put enormous pressure to many people in the region and in the world. You know, ADRRN started to look into this theme of innovation in our sector back in 2016 when we were thinking about the ADRRN strategy called Strategy 2020. And with a partnership with ADRRRN in the UK, we advanced in this area and created sort of a knowledge and experience base in the past 4 years. Some of the changes that we see before, people started to ask, what does innovation mean? You know, the things that we're doing in our project, is it innovative or is it not innovative? We don't get that kind of questions from our membership anymore. So I think the understanding of this innovation perspective is really, you know, becoming a culture within our colleague agencies within ADRRN. In this innovation venture, you know, we try to solve the unsolved. We try to look into the issues that we didn't before. And doing that is more than just an idea. You know, it's about looking at the whole system of why this problem persists and how can we overcome those challenges. So it would be great to hear experiences from Philippines, India, Indonesia, with your experiences from our colleagues. So with that, a warm welcome to all of you and look forward to hearing more. Back to you, Ikue.
Thank you, Takeshi. Now, I'd like to highlight some learnings of our Innovation Hub kind of like to open up the conversation before we welcome the speakers. So we are having the slides on the screen, and there you go. Thank you. So why community-centered innovation is so important for ADRRN, and it's been already discussed and then they shared with you for the last 3 years among our members, and as we are facing huge gap in resource and to overcome the challenge of recurring disaster and in its prolonged impact, we need to shift the impact level upward. So that's the short the message. But we are not talking about something completely different from what we've been practicing. And just to share the concrete example, I was listening to the presentation of Dr. Ramesh from MSET in the webinar they held early this week. And they encountered this promising technology of retrofitting the mesh technology using PP band. Some of you have already also heard about it. And he said it became social rather than technical. And that's exactly my point here as well. And invention becomes innovation only when there is, that the service or product is demanded, and when it's made accessible and affordable, to the people you are trying to provide that product and service. So there's no shortcut. But trying to have that, the ambition or the vision, so that makes this innovation program different from the conventional, the program, and as we are advocating, this innovation is no longer luxury, but it's a necessity for ADRRN. And so that's my point, first point. And the second, the next slide. And some of our learnings, just in short, it's important to understand the key roles for community-centered innovation. This diagram is a very simplified version, and then there are a lot more partners. But the combination of the strengths of each stakeholder is the key determinant of success. So, that we always have affected community in the center, and we have the new technology, the science that can, that address those problems. But our assumption is that the community and technology is there, but the innovators, we call them the idea holders, innovators, and then who can see the problem from the different angle and capable of working with the different partners is still weak. And they are not provided enough resources and spaces. So that's one thing. And then second, we need the catalyst who can empower the innovators by providing the resource and network. So we are hoping that the CSOs can play this catalyst or facilitator role, and that's what we've been doing. And then the YEU, CES, and CDP, they are the catalyst here, and they are really playing the key role. And in summary, next slide, please. So the critical elements for community-centered innovation, I think there are more, but just in summary, that it's important that the innovators see the problem from different angle, through working with new partners. And many times when the innovators come from within the communities, they know the context of the community very well. That's an advantage, but they tend to have an ants eye view. So it's important for them to have a bird view. So that's something we're trying to support the innovators through the innovation workshops. that we provide. And the demand is created within the community. So now we are convinced that technology, our concept works, but is how to create the demand within the community. So that's the next challenge. And the third, the evidence is also important to influence the behaviors of key stakeholders. And I think the majority of the programs know that the duty bearer, the government is the most the important key stakeholders to engage with. So the evidence is critical. And finally, making the product or service affordable and accessible. And I think that drawing the case of NSET again, they've made a great achievement already. They collected the evidence, and then they also created the demand, constructing, that retrofitting more than 200 the schools. But they also see the challenge as making the product more affordable and accessible. So that's probably what they are trying to overcome right now. So these are the journey that innovators need to go through, and to, the speakers and ourselves, we are trying to support that journey. So these are some of the learnings, and now we would like to turn to our speakers. And I will throw the first question just to open up the conversation. So first question, how it's been like to be working on building community-centered innovation ecosystem, and what are the progress and challenges to be highlighted? So I would like to invite Ina from CDP Philippines. She's been working with the CDP, and she works as she's a program associate, and she works as a facilitator and then also as a mentor to local government and other stakeholders in conducting their community risk assessment, ADRRN planning. So Ina, the floor is yours.
Thank you, Ikwe. Good afternoon, everyone. Okay, so just to answer your first question, how's it like to working on the building the community-centered innovation ecosystem? Going into doing this in the Philippines, the process was not without difficulties, but as much as there are tedious processes and tasks involved in doing so, there are also a lot of jigsaw puzzle pieces that are already there. And in support of the innovation project grant with ELRA and the Humanitarian Innovation Fund and the ADRRN Tokyo Innovation Hub, PhilPrep was we have the Philippine Preparedness Partnership. It supported the innovation teams in their research and community assessment. So in those gaps, or in the times that the grants were not in motion, we tried to get the support from our partners in supporting this research and community assessment of the innovation teams. This further assistance to the groups gave them the opportunity to learn more about the community and to establish solid communication with them. So CDP met with some of these jigsaw puzzle pieces as part of our scoping. And for the community-centered innovation system, aside from the ELRA innovators and their partners, we were able to tap Tuklas Innovation Labs, which is a community of innovators themselves. In these discussions, it was identified that one of the main challenges, if not the number one challenge, in sustaining innovation systems is that most of these platforms are project-based. After the project finishes and funding has ended, so does the conversation about community-based innovations. So with this in mind, and to mainstream and ensure community-centered innovation, CDP proposed a mechanism or a platform intended to beef up resources on the ground for local innovators. It is a good thing, however, and a welcome opportunity that there These efforts are now being funded by our partners. The Innovation Academy, it seeks to do three things: to collaborate, to advocate, and ideate. So, building on the innovation experiences from the grantees and from other local innovators in the Philippines, the capacities and the risk assessments, organizing local innovators will be the first step in developing the Innovation Academy. So, as a mechanism which responds to and highlights local and community based efforts for earthquake preparedness. The second one is to advocate to duty bearers to support local innovators. The Academy will be a data bank of local innovative ideas of different stakeholders, such as from the national and local government and private sectors who can eventually invest in these innovation ideas. The third one, finally, is to ideate and implement the case for innovation projects. So that's what we have now insofar as building the community-centered innovation ecosystem in the Philippines, ICWE. Thank you.
Thank you, Ina. Now, I'd like to invite Abhishek from SEES India. And Abhishek is a senior associate of co-founders of his SEES. And he's just like Ina, he is the main, the lead, the who implement our innovation partnership. And in India, we are actually transferring the knowledge, and then also that of the innovation management. And actually the SEES is now the leading the innovation workshops themselves. So I'd like to invite the Abhishek over to you.
Thank you, Ikwe. Thank you, Takeshi-san, for this opportunity. And like Ikwe has briefed, I, along with my main job here to assist the co-founders, sort of lead the innovation initiative at Seeds. In response to the question that was posed, I'd like to sort of structure my answer in three parts. I'd tell you briefly about why did we decide to do this, just as a background. Why are we investing time in building a community-centered innovation ecosystem? And then what have we done so far, and what do we plan to do in the future? So Seeds, as some of you might know, has been working in the sector for over 2 decades now. And as part of our own work, we would have had what one might consider innovations or innovative approaches to doing certain work, but there was a certain felt need where we were not able to scale or access the right resources or knowledge to sort of replicate that or to scale it up on a larger in a larger region. And from that sort of need, did the realization come to need to work on a local ecosystem, which sort of bridges the gap between the global north and the south in terms of knowledge and resources. And when the opportunity presented itself for us to be the local partners, to be the country focal point for this particular project, we jumped at it. And that's how we started working with the ADRRN Tokyo Innovation Hub and ELRA's Humanitarian Innovation Fund about last year. I mean, India is a large country with a wide array of problems, and one can't, of course, go about all of it at once. So the first one that seemed relevant for us to jump at, and the first challenge that we sort of worked with, was around the topic of water, about both flooding and water scarcity, and that's what our first sort of cohort of innovators who came on board, worked on. We had about 8 teams who came on board, have some very interesting ideas, starting from commodification of wastewater to how to create an enabling system for uh, persons with disabilities and elderly to be prepared for floods, to creating a citywide information system and messaging system for delivering local reliable flood information, and so on and so forth. There are other ideas, and a few of them, 3 of them to be precise, have actually been successful in getting further funding from HIF, and are soon going to start working on these ideas. So that was the first challenge, and it was as much of a learning experience for us at Seeds internally. And like Ikue mentioned, in the first process, we did involve some of our colleagues who helped facilitate these conversations. And we aim to sort of percolate that into our, and also into other partners that we work with. And I mean, just to reiterate why the need for working on community-based innovation is, there is, if you from our experience, there was a strong focus on jumping to solutions at the word go, and there wasn't enough focus on actually recognizing and understanding the problems better. So one big learning experience from working with the first cohort has been that we've been able to sort of sensitize them about focusing on the problem as much as there is a need to arrive at a solution. And with that experience, that it has sort of inspired us to, and made us realize the need for putting in more energy and effort into creating this ecosystem. We are soon going to, I mean, or rather have in place now a humanitarian innovation lab based out of India, where we want to work with further more partners, bring in strategic allies who can help us democratize this and take it to more people in the sector, uh, in line with our own organizational strategy of working on the climate emergency. We are in fact soon going to launch a call about innovators who have potential solutions to extreme climatic events. That's where we are going to work on next. Uh, yeah, I'll sort of stop here and get back later. Over to you. Thanks.
Thank you, Abhishek. Great sharing. Thank you. And finally, I would like to invite Happy. She's the program manager for Yakam Emergency Unit, or YEU. And we are now trying to form the partnership together. While the Philippines and India, we've been already working on this innovation program. The Indonesia, they are about to launch the program. So let's invite Happy. Over to you.
Okay, thank you, Ikue. Yeah, responding to your questions, first of all, you is interested to engage in the community-centered innovations because we want to learn how community perceive risk and what are their main problems, and also how community has perceptions on innovations, because innovation is not always about technology. It can be a new technique, a new knowledge, or a co-creations. So we want to know from that point of view. And secondly, we also would like to support community and also local collaborators for designing and also developing their innovations, innovations that is scalable and also addressing their priority of needs. And the support itself, it's not only financial support, but also it could be technical support, and also creating the enabling environment for partnership or collaborations among different sectors. For example, between humanitarian workers with the community, and also with the academe, or with private sectors with a digital technology background, for example. And this community-centered innovation is very much different to the in terms of the working mode compared to the conventional program, where we have where we have a set target with a logical framework, which is a relatively fixed framework. In this community-centered innovations ecosystem, we use a learning journey, where we have in this learning journey we have a space for explorations of ideas, and then discovery of the innovations, development, and also growth. And in each stage, we need to consider how community can influence the process. So how they could influence in the innovation design, which is beneficial for themselves. And the community must be consulted to identify their pressing needs, and even the community should be part of the technical reviewer to the proposed solutions or proposed innovations that will be brought by the local innovators. The learning journey itself is a cycle that can be repeated until the desired innovations has been reached. So it can be one cycle, two cycle, or more. And this community-centered innovation is also using adaptive project management, which give us a safe space to always revisit and improve the program design. So I think this is quite flexible in a way that we could always modify our program strategy to ensure that we achieve the desired result. And most importantly, this community-centered innovation is also part of the commitment of the localizations, where it empowers the community and also enable local innovators to develop their solutions. Thank you, Ikwe. Over to you.
Thank you, Happy. So now we have the presentations from the Happy and Abhishek and Ina. I would like to invite Takeshi again to lead the discussion here.
All right, thanks, Ikwe, and thank you. Very interesting perspectives and experience. I've got some questions that I want to ask, and I understand that none of you have received these questions beforehand, so I'm really looking forward to having this lively discussion. Let me start with you, Ina. You talked about the importance of having this research and community assessment, right? I mean, it's a natural thing for organizations like ourselves to say, you know, we understand the needs already, but then why is it important to have sort of a dedicated resource provided to do this research and assessment as a separate process?
I think it's extremely important, not just in research that we have these resources, but these research that we have conducted, it really enabled the partners to be close to the communities, to learn more about their dynamics and the community, and what really their felt needs are. And sometimes, you know, during a project implementation, these things I think these are kind of limited, you know, by the time that the project has set out for them to do, you know. But these additional instances for them to research and get more data, really know the people on the ground, and that can be done with these resources. So that's really important to know more about the people that they're going to work with.
I see. I see. Thank you. Similar question to Abhishek also, because you also mentioned about the specific step for recognizing and understanding problems, right? And sometimes that we have a tendency of jumping to the solution without fully understanding. So from your experience in this innovation work in India, so what was different by investing into this recognizing, understanding problems as a separate process or dedicated process within this whole journey?
Yeah. So we, as Takishistan, you're aware of it, but for the benefit of the audience, so how we went about working with the innovators was we did a set of 2 workshops in which we start off with sort of initiating them to the idea of innovation management, helping them with tools where they can probe their problems further. And then we give them a break for a bit to go research what their ideas are further on before they come back for the next workshop. And we clearly saw a difference when they first came in to when they came in for the second workshop, about how those tools had helped them and made their solutions more relevant and appropriate. So it's not just so by when we don't uh, probe enough into what the problem is, or study the context well, or look at what others might have done already. It's not like innovation is not only invention, right? It could be just a new way of doing something. And then and 9 out of 10 times there'd be people who've sort of catered to or solved that problem in some way or the other. And how could you learn from that, and what could you adapt from that, was a big part of that learning. And those sessions and those working with the groups on those aspects saw us sort of improving their own ideas better. We were only, like Ikue mentioned earlier, we were only the catalysts or facilitators for this process. They came in with the problems that they had recognized and had felt that the local communities that they work with need a solution for or have a solution for. This whole process of uh, providing them the tools to think this through and opening their sort of worldview made us see getting them better at whatever they had in mind. So no two minds about investing in that further. The solutions will come if you know your problems well.
Right, right. No, thank you. One of the things that I have been learning through this journey with you is that it's really about the process. It's about the journey that people go through, and investing into the process and not in the final product or service is the key perspective to have in this innovation program. And today we have colleagues from ADRRRN listening in from the early morning in UK, I think, and I think we're so grateful that that we have their understanding, that they're on the same page, of investing into the process is so important. And by doing so, like CDP in the Philippines and like SEAS India, you guys are really building this innovation as a key organizational strategic theme, and you're growing as such, which I think is also a great impact from this program. And why you Indonesia colleagues will follow. Happy, we've been sort of designing this process with you for the past months, and you said in your intervention just now that the community-centered innovation, so this innovation program designing, was completely different from conventional programs. And I know YU does lots of these conventional programs, and you guys are experts, right, in running these projects. So can you elaborate for the benefit of people listening to today's webinar also, can you elaborate a bit more how different it was? Was there anything that surprised you? or shocked you? Or can you elaborate a bit more on that?
Yeah, yeah. I think in our conventional program design, we will we will have a log frame where there is a target output and outcomes, and also with the fixed means of verifications. For example, we want to measure how many people will get a training, for example, and we already have a fixed activities on what training that we will implement it. But in this program learning journey with the community innovations, we only identify what is the big issues. Like, for example, we identify that our big theme is on inclusive humanitarian response and inclusive DRR, but we will not provide a very specific activities or issue to address. For example, we will not say that we will implement or will not we will develop an inclusive early warning system, but it just like a big umbrella or big topic that we introduce. But later we will conduct community consultations and also multi-stakeholder consultations on what are their issues in DRR in the context of different kind of hazard. And we also identify what is actually the existing innovations and what are the gaps that are available. Most often in the regular program, we do the same things with the activities that have been implemented by other organizations. But here we try to provide added value. We try to improve the existing solutions, and also how to so there is like this growth developments and growth in this aspect. So I think this is quite interesting because it will challenge the existing solutions so that it could better address the barriers or the problems that are faced by the community. And also I also think that when we provide community, we engage community in the design and also in the decision making process, I think it will be more beneficial for the community. Not only how we try to fulfill the project or implement the activities that already stated in the log frame, but how in the process we ensure that communities are being benefited in this program.
Right. Thank you so much. And you also talked about this having this adaptive approach and learning approach. And, it makes me think, you talked about the log frame just now, and I completely agree with you. If log frame was so effective, why don't we use log frame in our lives? We use log frame in our jobs, but not really for our personal lives. We don't make one. Why is that? In our lives, it's more of adaptive management, and it's always about the learning. So, yeah, maybe making it closer to how we actually live our personal life is one way. And again, this innovation management process, I think, is about the journey, investing into this journey and having this adaptive and learning approach.
Yeah, and one thing that in this learning journey, we are also expecting the unexpected, that maybe we invent new ideas or new issues that are priority according to the community, which is we never thought before. So we allow these unexpected things to happen or to show up.
Yeah, and from my perspective, there's many things that all three of you have in common. Well, with Ikue included, four of you have in common, and one of them is a humility, in a way that you don't think that you understand the full complexity of the issue fully, but you have this mentality to explore the issues And I think that humility is also a critical element in running this innovation program. Trying to solve the unsolved is to understand how complex the issues are actually of this unsolved issue. So I think that's a very important perspective. Thank you, Happy. So Ikue, I think we've had quite a good, interesting discussion for the first question. I think we have the second question ready.
Yes, and just to add my comments, I just know that looking back that time we started engaging the CDP and Cs in a different time. Know that I remember how quickly they took up the essence of the innovation workshop. That how to provide the space for the communities to do the research and identify the problem. It's actually very straightforward. It's not new, but I remember both Ina and Abhishek, they really appreciated that to have that capacity to provide the space to the community. So I was thinking maybe that we are who are practicing humanitarian work, we are always pressed with time, and we know that this kind of research is really beneficial, but we haven't been able to do it as much as we want to. So that I also see that passion in Happy's comments as well. So that's something I was really glad to hear about. So okay, the next question. So now we have we're more familiar with the journeys of the three countries. Now I'd like to ask you the question about how COVID-19 pandemic is the changing, that the way you work with the partners, particularly with the partners, and if there's any positive change, we would also like to hear. And then the challenges, that's of course welcomed. So Abhishek, could you start?
Sure. So one thing which has become very clearer since the pandemic has hit all of us is especially from the context of India, the inequalities have become in the inequalities in the system of how much access people have to resources and knowledge has become extremely clearer. Some of us who are doing this meeting today, sitting across the world, thanks to technology, don't often sort of realize that technology, as much as it is an enabling tool, has some entry barriers. So during a recent call with one of our teams who is looking to work with people with disabilities and elderly, and a large part of their work had to do with actually working directly with the community and community members. Now, it's very easy to say that, we can do everything over the internet, but some of these communities don't have that access to smartphones or good internet connection. So it has certainly forced us to think of changing how we approach this. Technology is an answer, of course, but there are certain sort of quirks to it which we need to deal with. So that's one big challenge that I have seen or personally faced while working with partners and the communities on the ground. At the same point of time, since you asked about a positive impact, I feel the one thing which has come out positively is now for every dollar, more of the penny goes to the community and the affected community members, and we spend less on traveling and logistics. So I would think of that as a big positive, since the pandemic has forced us to stay home and not travel. A large part of that funding is now moving to the people who are affected by these humanitarian problems. Yeah, pretty much that. Over to you, Kwe.
Thank you. Interesting, the shift of the traveling cost for the people in the community. Thank you very much. Okay, so now I'd like to turn to Ina.
All right. Go. Okay. So
Yeah, go ahead.
yeah, COVID-19 brought about several challenges in our operations. The pandemic has affected 432,925 Filipinos for the last 9 months, and it's still affecting the lives of in the different facets of our regular Filipinos' life and even non-Filipinos. It has brought about problems with regards to mobility, to connectivity, since we have not so stable internet connection here, communication and coordination with partners, as some are also busy with their response in COVID and in typhoons. So we have that. We also have issues with scheduling conflicts, digital fatigue, since there are so many webinars left and right, and many others. But these are also informative that we really cannot stop getting involved and participating in these webinars. Now, to adjust through these difficult times, we really needed to first and foremost embrace technology. Same with Abhishek, and whatever is available. We are also thankful that funding mechanisms were also flexible and allowed us to shift budget for food and transport to communication allowance and other support services. So in the case of our partners in projects in the Philippine Geographical Society, the pandemic gave them the opportunity to stop and reassess the responsiveness and appropriateness of the project. So their maps and cards for DRR started out as a tool for inclusivity in DRR planning, but with no real expert on inclusive DRR on the field. With the pandemic, most of the activities they set out to conduct are no longer applicable. So, upon sensitization and rethinking, they did adjustments to their plan strategies. Logistically, they cannot spend on field work, accommodation, and meals anymore. Instead, they invested on online platform support services like cell phone load, honorarium, which honorarium, the Filipino Sign Language interpreters, closed captioning, and facilitators. The honorarium was a big help in these times with when so many don't have work, and these little amount can help them with their maintenance, medication, and therapy. Since Maps and Cards, this project is with persons with disabilities all over the country. Projects also has created expertise in DRR who were willing to collaborate remotely. So they had their compose sama-sama, which is to compose songs together, where they compose songs as a strategy for community building and environmental awareness. So it's part of that. They also conducted mental health and psychosocial support activities such as art workshops where parents and children with disabilities expressed how they cope with the pandemic. They were also able to shift the mapping method from the participatory 3D mapping, which is part of their project, into something where they combined mapping and social science research, which prompted more meaningful interactions between adults and children with disabilities in the communities. So all in all, they see that the flexibility was facilitated by the partners' flexibility also, ATI and ELRA, and in the budget, it also brought about and facilitated by creativity, reflexivity, which is reflection upon practice, and the power of consultation among sectors, networks, and connections, and very much willing participants. So, yeah. Thank you, Igwe.
Thank you, Ina. Yes, that was great sharing. And so now I'd like to invite Abhishek again. Over to
Yes,
you.
Ikwe. Yeah. During this COVID-19 pandemic, I think this is another momentum for us in realizing the commitment of the localizations. And during COVID-19, we empower grassroots leaderships in the humanitarian response that we conducted in Central Sulawesi. Especially, we built the capacities and meaningful participations of the most at-risk group. We train older people, women, and then also persons with disability on how to use Zooms, WhatsApp call, and also how to conduct online coordinations, as well as how to document their practice using simple video technique, and also how to collect data online using Kobo or SurveyMonkey. And actually, the results are quite impressive, in my opinion, because it is not only cost effective as being mentioned by Abhishek, because the operational cost is minimum because the staff doesn't have to travel. The experience from the COVID-19 pandemic during our rehabilitation program in Central Sulawesi shows that if community is well equipped with simple and user-friendly tools, they actually can collect good quality of data and information, and they could, if we communicate our program clearly to the community, then they will be able to reach the most vulnerable. For example, in Central Sulawesi, we community that we will conduct cash assistance for COVID-affected families, and we provide. We consult with them the criteria for the beneficiaries that eligible to receive the cash assistance. So they could reach this consensus on who will receive the cash assistance and identify who are the most vulnerable. And one additional lesson and insight from the COVID-19 pandemic is that when we conduct post-distribution monitoring on our livelihood recovery and also cash assistance program, we ask community awareness on the community feedback mechanisms that we have. Are they aware with the complaint feedback mechanisms? The majority of the people said that they know how to channel feedback, but the most interesting part is that people said that they will talk to the health cadres, they will talk with older people associations or disabled people organizations that work closely with us if they want to channel complaint to Yakum. So it means that the community also plays significant roles in the program accountability. Most often, when we develop our complaint handling mechanism, we will just establish a feedback box or hotline calls or through WhatsApp. But during this COVID-19 pandemic, we realized that the community themselves, the cadres, the local organizations that work closely with us is the most accessible and safe complaint channel for the community. So yeah, that's it. Ikwe, thank you.
Thank you. Well, so many interesting insights come back from each of you. And Abhishek, I think I took you off the guard. Sorry about that. Okay, now, so can I ask Takeshi to respond?
Yeah. Thank you. And it's great to hear all these sort of positive aspects in these challenging times also. Abhishek, I fully agree with you that more resources now going to the people because we haven't been traveling, and therefore the administration operation cost is lesser and more program cost that we can generate. There's also a downside to, I think, the current situation that, we can't meet physically. And one of the question was, how do you at SEAS running this innovation program in India, how do you make up for these difficulty meeting up physically, and any challenges that you hear from the innovation teams in the current context? If you have any things to share with us, that'll be great.
Sure. To be honest, there's no making up for not meeting in person. But what the situation has sort of enabled or forced us to start doing is also look at, because a lot of these teams work with communities on the ground, and because of the pandemic situation and lockdowns on and off, it has forced all the innovation teams to also partner with the government, even if they had not in their design earlier, because they need these permissions. They need the government's go ahead to actually go on the field. A lot of activities have now started being permitted on the field in India, but in some cases, let's say you can't do a large meeting, group meeting, but you can go and do individual stakeholder consultations or interviews. And because you need a certain permission or you need to interact with the government to go ahead with that, I feel that it is also creating a natural partnership, even if that wasn't conceived in the design. One of our partners recently informed me about how they have, I mean, when they actually go to the government, and there is a certain presumption or apprehension about there will be bureaucratic hurdles if you approach the government, and if there is no need, can we sort of bypass that? But it really depends on how you work with them. If you take them as partners, if you treat them as equal owners, sometimes they, I mean, in our own experience at Seeds, we've always worked with the government rather than creating parallel systems, because in terms of scalability also, that's a natural system that's already in place. And some of these teams are thankfully you going through that route, and that's something that I see as another positive to make up for the ways that we are facing right now.
Thank you, Abhishek. Yeah, one of the things that I also learned through this journey is having this true sense of partnership is so critical in this innovation program. Because when you take a look at the system, you're not only solving the issue that you can solve, but it's about the collective efforts to solve the common issues, right? And Ina, in the Philippines, you also talked about in this COVID era was it also gave the opportunity for new partnership, and having that flexibility always helped. Although that is really a beautiful story, and we love to hear that kind of thing. But we also know that behind these adjustments, there was a struggle that our partners on the ground had to go through. And that is often, though, unheard by the donors, right? They only see the result, that these people have readjusted, flexible way, and then this became like this, and that's a great story. But we also want to hear a little bit from your perspective and from your communication with the local partners, what kind of struggle that they had to go through in order to produce that adjustments that they made, if you have any.
Yeah. Thank you, Takeshi. It just reminds me of the days when, especially when the pandemic was just, in the early phase, that especially with the quarantine or the lockdown here in the Philippines. So, in addition to the communication because of the internet and sometimes even the cell phone signals are not stable at all. So in addition to that, we cannot really talk to people. I mean, they're just so busy with all of these other responsibilities that they have. But of course, we want to still get them involved because it is their own. I mean, they have to own it because it is theirs, and we can only sustain these efforts if they have it in themselves to continue with it because they see that it is, important, relevant to their own communities. So that's really one of the challenges, the communication, and to get people to participate. So with that, the deadlines and other requirements by the donors also fall in short. By that I mean we cannot really give definite dates, schedules for the work plan, and other things. So it is also good that our partners have that capacity to extend and really get to listen to that we have here. So that's really stressful in a way, especially these partners that we have, the innovation teams were also affected. It's not just their communities, but they themselves were affected. So yeah, thank you, Ashley.
Yeah, a significant struggle that they had to go through. But you kept that communication open. I think understanding each of the struggle and trying to have that partnership to overcome that the struggle is also, I think a clear message how this partnership and as Ikue was mentioning earlier, being a catalyst as a country focal point in the respective countries. I think it's also a key to success, right?
And then, sorry
yeah.
for the interruption. So while continuing this discussion, I would like to invite the questions from the participants. So far, I understand you are waiting for the discussion, but you are welcome to write the questions in the chat box, and so we can share that with the speakers. Yeah. Sorry for the interruption.
Thank you, Ikue. And please do, because the more questions that we have or more insights we have from the participants, the richer the discussion gets. So we'll be grateful for your questions and inputs. Happy, the thing that you said about digitalization, I thought it was really interesting. I too think that the time of, say, a disaster hits, and then the external aid agencies goes in and either with a smartphone or pen and paper and say, what do you need, and doing this checkbox kind of exercise and do the assessment. I think that era is going to be over very, very soon. There will be a time that it's primarily the perspective of the affected community that's being generated as an information to the aid agencies and say these are the needs. I think that time will come. And your idea,
it has come, yeah.
It has come already.
It has come already since the earthquake in Lombok and also the tsunami in Central Sulawesi in 2018. The Indonesian government did not open international assistance, so it's only very limited activity where the international actors can get into the country and provide assistance, but it in a very limited scale. So yeah, I think it has started.
I see. And in the near future, by having these digitalization empowerment at the local level also, what kind of impact do you foresee in Indonesia?
Yeah, I think there has been a growing needs where the local NGOs should also be facilitated, not only as or empowered, not only as a local implementers, but also how this local NGO could also be a facilitating NGO for providing smaller grant to other small organizations or community-based organizations, so that there are more resources that can be channeled at local level. Because even though now, like for example, Yakum, we has like a diverse donor. There are more than 12 donor agency from but we know that the requirement or the administrative requirement for this donor is very high. Not many Indonesian NGO that can access to these resources, international resources. The community innovations program that we have now from ELRA and ADRRN, I think give more opportunity for the local small NGO or CBO to access this kind of funds, which is with less administrative requirement, but still maintain the accountability. So I think we need more this type of approach or project for this to boost the localizations.
Absolutely, I absolutely agree with you. I think ADRN needs to do more of these, coming up with these intentional mechanisms, so that the more resources are there at the local level for local stakeholders, local organizations to come up with these solutions to implement them.
Yeah, and also we need to invest on this, like for example, disabled people organizations or older people organization and other community-based organizations to have to increase their institutional capacity to manage the funds as well.
Right, absolutely. Ikwe, I'm not seeing questions in the chat. So if it's okay with you, can I ask sort of a follow-on question to Abhishek and Ina?
Yes, of course. Go ahead.
Happy just talked about local organization being the facilitating NGO. And doing this innovation work in partnership with ADR and ELRA, you guys are not only doing these innovation work per se, but also being sort of the facilitators and catalyst. So how is that role different from being just an innovator with an idea to implement? How is that different when you actually become that facilitator role? Maybe Abhishek?
Sure. So to start off with, I mean, as a facilitator and personally from the experience, it has opened our worldview quite a lot. And sometimes we work in these bubbles or talk to people in echo chambers. But how we had designed the program and it encouraged people to come from other sectors, not necessarily humanitarian agencies, and look at how they approach a problem has, I mean, not only helped the participants, but also us as the facilitating organization to think of new perspectives to an existing problem. Also, one, in a way, learning, you could say, is that we need to do as facilitators as opposed to innovator. As an innovator, you would always want to scale up or chase resources, but as a facilitator, you need to do both of that to, I mean, for innovators to come to you if you create that ecosystem, but increasingly also go out and look for these, because some of these extreme local innovators will not even have the access to the information that you're providing or the advertisements that we put out or the themes that we are working on. And these people could be, these community-based innovators could be people who have had these solutions, or these are born out of traditional wisdom rather than high-end technology, but have never had the sort of supporting ecosystem to help them improve it further. And as a facilitator, I feel our role is to also go out and look for those rather than just waiting for people to come to us.
Right.
Yeah.
Being proactive. Ina, how about you from your perspective?
I agree with Abhishek. I think that being a facilitator is not just being a facilitator. I mean, you're an extra staff in the innovation team, so you're another member of that team. You also facilitate with the donors. I mean, there is a part of that. You're also an advocacy person for them. You know, to connect and make sense of the bigger environment where this really fit in. I mean, for them to scale up and scale out, it needs also the site from a global or regional perspective, not just in the community. So you're a connector, you're an you're an advocacy person, a champion for the team as much as a member of the team, and yeah, as with Abhishek, you also try to support them and provide them with all of the information that they would or might need, and just really a supporting actor for that innovation, but also playing a big role, outside. Thank you.
Yeah, indeed. Any comment on this, Happy?
Yeah, I think as a facilitating NGO, we also have a greater responsibility, because if, for example, the partner is not performance is not as expected, then we have to sit together and talk with them in a good way. I mean, like in an encouraging way, so that we could find the solutions together. And so not on so it's not transferring the risk to them, but it's like our main responsibility to make the program is well implemented. Yeah.
Yeah, absolutely. Being that supporter, I think that's critical, because everyone's trying to do in this innovation type of program. I think everyone's trying to do something that has not been done in the past, which also means that the idea is not being tested in that context, right? And it's so easy to just look at the results, but in a lot of times, what I also see is that there's good time when things are going well, and there's also a difficult time. And it's easy for people to be together in a good time, but I think the true picture of this partnership is revealed when you actually go to the lean time, the difficult time. And if you're able to say, well, with these people, I still want to continue, and I still want to explore the possibility of making a success, rather than saying, well, it's too difficult, let's quit. So having that sort of support base for local innovators in this journey, I think is also a critical element in this program, as you say. Ikue? Any thoughts?
Yes, I always have also have a questions to Abhishek, Ina, and Happy. That I listening to you, that you are playing the multiple roles to the multiple the directions, and so that's the challenge, and also I think the importance of the the facilitator. But to my understanding, each organization have their own strengths, and using that the strengths to support the innovator is actually the element that makes the program unique, and then also can be the driver. So know that the some facilitator, they are really good at linking the innovators up with the government, and then some of the organization may really good at working with the private partners. So in case of the CDP, YU, and Cs, what type of the strengths do you think is really using in this in playing the role of the facilitator?
Yeah, I think one of the strength is that we have to have a good communication skills to the partner. And I think I also learned a lot from the partnership with ADRRRN and ADRRN, and how good communications can create positive vibes, positive atmosphere, and not make the partner become stressed, especially if there might be some challenges in the project. And secondly is that also how we have the common understanding with the partner that we when there is a problem, actually the partner doesn't have a safe space to communicate their challenge. So not because there might be some cases where the partner doesn't want to tell, but in the end, there might be some challenges, but it's too late to be responded. So I think if we have a good partnership and power balance, I think it will bring strength to the partnerships as well.
Yeah, thank you. Working with you, I'm always impressed, that with the way you communicate, very up to date, and then also in a way that that the external supporter can understand the context of Indonesia. So yeah, I'm glad to hear that from you. How about you, Abhishek and Ina? You have so many, the strengths, so you might have a difficulty in selecting one.
I don't if that's the case, but a strength that I think we do have, at least in India and in the region, is the networks that we have built over 25 years of working in the sector. So, I mean, when a partner reaches out to us for a certain sort of requirement, which is not in the typical sense in the scope of what we should be doing, but we're always there to help out in terms of, if not, if we can't provide the answers, we will more often than not have someone or know someone who we can put them in touch with. So that's a big advantage that I would imagine is there. The other positive or the strength that I see is that because we have grown to become a fairly decent sized organization in the space in the country. We are constantly working around different regions. We are responding to all the major emergencies, disasters that happen. So even beyond the scope of this project, uh, we would treat them as natural allies or partners. So it's not just that they are partners for only this specific project. They are seeds partners, and we would reach out to them and seek their help as much as they seek our help in other contexts or other situations. So that also helps us in nurturing and building those relationships over time, and that's how I would imagine we have. I mean, we have a formal network of partners also, which has about more than 80 organizations within the country. So that's how we've built those relationships. It's not just about signing an MOU, but yeah, I'll stop there.
Thank you. So by helping the innovators reaching, the network through you, that you are also building the, the network of your own. So that's that the continuous, that the communication can actually, the work building the network on both sides, both on the innovators and then also that facilitator side. Yes. Thank you. Yeah. Ina, you also
Yes.
have the comments? Yeah. Okay.
Yeah. Well, same as with Abhishek, the organization has, well, for CDP, in the case of CDP, we have a long-standing relationship. Yes, Taro. We have a long-standing relationship with the government and other civil society organizations in the national, going to the local levels. So we also have that, and we have broad membership in different networks and the disaster management in the national level. So pretty much we have all these kinds of partnerships and collaborative engagement. And I think, as same as with Abhishek, the partnership really is not it's not something that just happens overnight. So as in our case, we really do give premium in feedback. So since our partners are also long-time partners, even when we just started out in CDP, it is easier, I guess, for us to speak our minds with each other, and even those things that are not for virtual meetings, but for our ears only. But we can say those things with each other, and you know like that, and they can be taken constructively. Thank you.
Yeah. Thank you, Ina.
Just to add in there, I think
Yeah.
one other thing that we as a practice also do is to treat them as equals in certain sense. And if there are, and this has happened more than once, is certain times we come across opportunities that we cannot work on of a certain lack of a local context or expertise. And we're very happy to pass them on to these partners who could then do a better job at it. So that's something. We're all working on this together, and that's how we like to see it.
Yeah. Good point. Thank you, Abhishek. So I think we are really keeping the good track of time, and I think Takeshi, it's about time we can wrap up, unless anyone have burning questions from the audience.
I think Taro
I
has
guess.
a question, but I can't.
Yeah, I know. Hey, my son has something to say, but but otherwise, the people, I think people are holding the questions with themselves.
Sure.
Yeah.
I think we can.
Before to conclude, I just wanted to sort of say that it's not just because I'm saying for the sake of it, but it's a genuine realization that, like you mentioned, you at the ADRRN Tokyo Innovation Hub and our partners at ELRA and the Humanitarian Innovation Fund have understood the value of investing in the process and the journey, which a lot of actors in the space don't do. And there has been, I feel that is our biggest strength in terms of this partnership, that we've been able to get out a lot because we've invested in that process rather than just being a donor or facilitator role.
Thank you, Abhishek. Really appreciate that, because that's something that we truly believe in is necessary in localization as well as this innovation. And that's the spirit that the ADRRN really wishes to carry forward. And meet our newest member of ADRRN here, Taro. All right, then I think it's time that we can wrap this up. And thank you, Abhishek, Ina, and Happy for your insights and sharing of your experience, and Ikue for organizing this this panel. And I think we have learned from your experiences and from your insights. And you know, it makes me think that people talk about we live in a new normal era, and I think it's time that we ask questions about what's normal to us. I mean, is it normal to have, like in my context in Japan, I think we need to ask ourselves, can we have this normal that we get affected by this torrential rain and flooding every year? And then we have these, particularly the elderly, who gets left behind, not being able to evacuate on time, and they drown. Is that the normal that we can really have? I think we should keep on questioning what's normal, what we think is normal, and try to unpack why these issues are occurring, because I think that's the only way for us to solve the unsolved. And without solving the unsolved, the increase in disaster risks that we see with the climate change impact also it's surpassing the amount of resources that this society has. So we need to be creative about solving the current issues. And that's why, you know, as ADRRN, we wanted to also invest in this theme of innovation. And we consider the role of network is all about connecting experiences, connecting resources, connecting people from different age, including the young ones like Taro. You know, ADRRN has this vision 2030. By 2030, when Taro is 10 years old, I think, we would like to see this region not the most disaster-prone region in the world, but the most disaster-resilient region in the world. And in order to do that, I think it's clear to us what needs to be done. And in order to get there, as Ikue mentioned earlier, innovation cannot be a luxury, but it's a necessity. We would like to see this spirit of innovation, perspective of innovation being embedded and performed by all members of ADRRN and partners. And we would like to see ADRRN as a platform to enable that for our membership and partners. So with that, thank you all. Thank you all the panelists. Thank you, Ikue. And thank you, colleagues at OCHA, for providing this platform. We truly appreciate the partnership that we have with you and with ICVA under this Regional Humanitarian Partnership Events 2020. And thank you very much for all who have been listening to this webinar. We truly appreciate it. So everyone have a great day ahead. Have a great evening, and thank you, and bye-bye.
Thank you. Thank you.
Thank you.
Bye.
Bye. Hey, May
Bye,
4th.
Taro.
Bye. Bye, May 4th.
Hi, Ike. Congratulations, everyone. Congratulations, everyone.
Thank you.
Thank you. Take care. Bye-bye.
Bye-bye.
Bye.
Bye-bye. Bye-bye.